Okay, so we will now like to welcome a good friend of the Latinx house and Raizado Fest co-host, Annie Gonzalez.
Bueno, sí.
Annie Gonzalez is not just a friend of the Latinx house, she's an amazing actress. And you're gonna be seeing her in the new movie, Flaming Hot. I mean, too many projects. I mean, you've done so much, but this is your new project, Flaming Hot. She's one of the lead actresses. Eva Longoria directed the movie. So when you see this movie, please announce anywhere, please watch it, okay, and support Annie. She's gonna help us lead the timely conversation on reproductive and maternal health with Adrian Manzanares, the president and CEO of Planned Parenthood of the Rocky Mountains. Yes, bravo, muchas gracias. And Cristina Solis, Political Director of Colorado Organization for Latino Opportunity and Reproductive Rights. Again, thank you so much for being here. Annie, take it away.
Hello, everyone. Welcome. Thank you. Thank you for showing up early for this beautiful, brilliant, empowering conversation that we're about to have. We hope that we can open up a space where we can have open hearts, open minds, and just absorb the information. We also want to open up the floor with us along with the Latinx house, acknowledging that a lot of the language in your programming is gendered. But we do, and you will hear within the conversation that we're about to have here, we're going to acknowledge the full spectrum of people who need access with dignity. So let's just get started, yeah? Yes. Amazing. You know, there's a lot that we can get bogged down about these days. One in particular is the overturning of Roe versus Wade and the Dobbs decision, which I know is it was painful for me to come to terms with, and I'm sure most of us here. Let's just get this conversation started, shall we? So there has been, there's a lot of conversation around period poverty and the lack of access to materials and to hygiene facilities and to a lot of knowledge surrounding our periods. I feel like there's a lot that I don't even know. So can y'all inform me and help possibly inform this beautiful audience?
Of course, and thank you all so much for being here today. And I just welcome you on behalf of Planned Parenthood of the Rocky Mountains. We're a 4-state region, so Colorado, New Mexico, Southern Nevada, and Wyoming as well. And increasingly, we are seeing more of our patients come in for tampons, period. Get it? Period. I didn't even try. I wanted to write that down. That just came to me.
That's how humorous it is that we do not have access.
Period, Annie.
Come on.
That is a devastatingly sad thing. And not only do we have more patients coming in for menstruation products, because either they can't afford it or they're not available to them, we also have more and more patients who are coming to us, many Spanish-speaking patients at a very young age who don't understand and know their own bodies. And they don't understand and know their own bodies in part because they're too embarrassed to talk to family about it. And often it's because they're going to schools where there isn't a health teacher that they feel safe talking to. They are too embarrassed. They don't want to go to a gym class. There isn't a trusted adult in their life. And so for any of us who's ever been to a Planned Parenthood, you know it is a non-judgment space. It's a space of compassion and a space of caring. And so this is an issue I think that we, again, don't talk about very often, but we're seeing a lot of it and a lot of searches. You know, young people, like many of us, I have a big question. I'm gonna get on Google. I wanna try to figure it out on my own. And there can be a lot of misinformation online as well. So we're really pleased to be able to provide, whether it's based on an app or just good information. Often it's face-to-face in our health centers. Yeah.
That's amazing. Thank you. Yeah, Christina, can you tell us?
Yeah, so I feel like period poverty happens whenever, like,
we're oppressed, right? We are in these systems that are not built for us, not built around us. There is still so much stigma around just having a period. So like Adrienne was mentioning, like not wanting to talk to your family about it, not wanting to like go and ask your friend at school for a tampon, like...
Yeah, I remember when I was a kid, my grandma, I was using tampons at like 12, 13 just because I didn't like the mess.
Yeah.
And she was like, you know, mija, if you use a tampon, that means, you know.
Yeah.
Like, there's so much shame surrounding our bodies at such a young age.
Yeah, and oftentimes in our schools too, thinking about young folks, like the period products that are there are in only the girls' bathroom, and you have to pay for it. So what if you are a transgender student who cannot use the bathroom of your preferred gender preference? What if you are trying to figure out how you're going to pay for your school lunch, but you also just got your period and you can't ask your peers or your teachers for it? So I feel like all of these systems of oppression, and especially for our communities, the stigmas around everything just really play into it, and it's like a broader conversation. But some cool things happened in Colorado.
I will say we are seeing pockets of hope, and it's right where you think they would be, in positions of power. So school boards that have been overrun by young people saying, we want this stuff in our schools, and it should be free. And we see that across the country, often based in a Latinx organizing model, which is awesome. Yeah, it's really, it's a good testament to how when people come together to fight for something they want, and some of these high schoolers, they're already in college by the time the school board changes. They started doing it their freshman year or maybe in middle school, and year after year going to school board meetings and disrupting those meetings, and now being able to celebrate across the country.
So tangible ways that we can create change is going to our school board, advocating for these young kids that may not be able to advocate for themselves.
And just carry a bunch of tampons and pads around with you and hand them out for free.
Men and women and the non-binary pals, all right? Everybody carry some tampons and pads with y'all, okay? We could all use it. I could actually use one later if anybody has one. Okay, so we have our next one, Adrienne. So this is something that I mean, not shocked. It's just freaking disheartening, man. The statistics around maternal health is that the United States ranks highest in maternal mortality rates, and that number is on the rise. Sheesh. It is really tough, and I think we need to, sorry, it gets me a little emotional. What are some of the underlying factors that have caused such risks for the Latinx community members who are having children, and why did things become more acute during COVID-19?
Sure. So we're hearing this a lot during the festival, and we'll continue to hear the healthcare systems are not built for us. They're not built for us. It's really hard just to even take a family member, let alone everyone you're carrying around, to a doctor's appointment, for example. It's really hard if you are bilingual to have to tackle justice issues around language, and you're trying to describe a pain or a feel, like how do you, what is it, puffy? So just to say that there are just these systems of oppression, as you talked about, Christina, and what that then results in is higher levels of blood pressure, not having access to prenatal care, prenatal vitamins, and so then that means more likelihood of having troublesome pregnancies that can lead to death. And I just want to be really clear. It's very acute in Black and African American communities. And we have seen celebrities come out with this. We've talked a lot about the ways in which urban centers are thinking about Black pregnancy and planning Black families. And that is so critical, because when more money and more knowledge and more stories go into any community, we all do better. So it really is a cross-racial issue that the solutions must be as well.
Yes, and I'll just add, if I may.
Please.
I was actually doing a Reproductive Justice 101 training with our partners at Soul to Soul Sisters, a local reproductive justice organization here in Colorado. And we were talking about birthing justice and how exactly what Adrian's saying, the systems are not made for us. And oftentimes whenever we're talking about these things, the onus is put on Black and brown bodies, and it's our fault that we can't have successful pregnancies, when that's just not the case. It's exactly what you were saying. It's about the systems that weren't built for us. It's about taking away access to community care, to midwifery, all of these things, doulas, all of these things that lead to better outcomes in pregnancies that have been happening for years before pregnancy was like hospitalized and medicalized. And I think that is a real lack of access that we have for our communities here.
Oh my goodness, what are some ways that we can help bring change or help inform? Is it just by having conversations like this? Is it like...
Yes. It truthfully is. I mean, we've been talking about it a lot of, we can't let what we're learning today, yesterday, tomorrow, go by the wayside in our work. When we get back to really important work that we're all doing, we have to be able to have these cross conversations that connect things like transportation, that connect things like childcare, that connect things to representation in the medical field and our ability to send our kiddos to med school so that they can be there for that woman when she is facing and has all of these questions, because they look like her and they look like her own children, and that trusted, most precious relationship with a care provider. And all of that is wrapped up in the good work that everyone is doing. So it's I don't want it to sound trite. It is so important to talk, to bring up issues, to share our stories. We're all connected to these stories. And it does require some research, some getting some informed, whether it's, again, through watching people tell their stories or making sure that you're in a trusted environment where you can get information. All of those things are tied together. And then, of course, it leads to making sure that we are voting for leaders in this state who look like us. Amen. And being much more connected to running for office, supporting candidates, getting people involved at all levels of boards, of regulatory environments. And so, again, so that our policy makers and our decision makers look like our kiddos. That's so critical. Would you add anything, Christina?
You took the words right out of my mouth.
Oh, you got to go next time then.
Beautiful, beautiful.
It was perfect, yes. And not only look like us, but share our values, right?
Sure.
Like making sure that we're holding the folks that are accountable in office right now accountable for what policies they're passing, making sure that we have seats at those tables.
Yes.
Well said.
Yeah.
The value sharing, I think, is critical.
Value
Let's give it up for
sharing.
Christina.
Yes.
That was awesome.
Can we give it up for both of these beautiful ladies up here,
Yeah.
just sharing their knowledge, speaking truth to power? Just a reminder, I know this is a lot of information coming at us. It, can make us feel uncomfortable and all the things. If you want, pull out a notebook, write stuff down so you can remember it, reference it later, because this is a lot coming at us. Be patient, be kind with yourself. We're all here to learn, to grow, to be better. Can you, Christina and Adrian, this is for both of you because you guys are both so brilliantly informed, can you share some of what we know about cervical cancer and how it's predominantly affecting the Latinx community and what's being done to address this issue?
Sure. Do you want me to take it?
You take that one. You're the health expert.
I'm not a doctor. I play one on TV. I don't.
No, I do.
Actually, Annie does. There are 3 things I want you to know about cervical cancer. Number 1, it is an undetected fatal cancer that lives can be saved through screening and testing. Number 1. Number 2, it disproportionately impacts Latinx people with cervixes, so mostly women. And especially in high density areas like in the San Luis Valley, where my family's from, where there is not a lot of access to care. And number 3 is 99% of cervical cancer cases are caused by HPV. HPV is a sexually transmitted infection. We've got vaccines for them now. It's spread most of the time without symptoms. So you may not know that you have HPV, and then it leads to cancer in women and people with cervixes. So please get tested. And I say this, and I'm gonna say it with the warmth in my heart. We have many patients, women, who come into Planned Parenthood for birth control, and they say, well, I'm in a monogamous relationship. I've been married 5 years, I don't need to be tested. And we say, why don't we just go ahead and get you tested? Let's get tested. We have a donor who can help pay for it, or it's only however. And to give the news to that person that she has HPV and that we want to get her screened for cancer can destroy a life. I mean, think about how horrible that is to hear. Then when she comes back and says, thank you, you saved my life, and what a fuck face, I'm so glad I'm out of that marriage. It's true. Please do not doubt the importance of getting tested for any sexually transmitted infection, especially now with the pandemic. We have a lot of public health officials appropriately that are focused on that pandemic, on the virus that is COVID. So we're missing out on attacking, preventing, and treating infections that are sexually transmitted. And they're just as harmful to all of us. And it goes back, Annie, again, to that stigma, to the shame, to feeling embarrassed, to feeling like you're in a relationship and you can trust someone. I'm not saying don't trust your partners. I'm saying, why don't you both come in and get tested at Planned Parenthood?
Yes.
Yeah. And I can just add, I mean, it's not health related, kind of. Color was founded on that reason. We, like our founding madrinas, saw the rising rates of HIV and AIDS in our communities and saw this health crisis that was happening and knew that it was about more than just the access to health care, right? There are other factors that like play into our lives, like economic justice, immigration, all of these other things that we're thinking about and intersect with all of our identities at all times. Like play into that. And our madrinas knew 24 years ago that we needed a way to address these things. Like the healthcare part, so important. But addressing the other systems of oppression that impact our lives, also equally as important. And so as a grassroots organization focused on reproductive justice work, I'll just add, like, it's so critical that like we're working together and talking and addressing all of these identities and issues that impact our lives.
I agree. I think that's why we're all here. That's why we're all here at this conference, because there's so many different spaces that we need change and we need information. Speaking of information, public attention has been focused on the U.S. Supreme Court's decision.
You brought it up, Annie.
In
You had to bring it up.
versus Jackson. I had to. I'm trying to bring it up as swiftly as possible. What can you both tell people about this decision? Just take it away.
Go first this time, Christina.
Okay. I will start by saying that our communities, people of color, have known, advocates for abortion access and all of the people in this space have known for years that this decision was coming down, years before it even came down. And we also have known that Roe has never been enough to grant our communities access to abortion care. So while it was devastating to see the decision come down, to see the leak happen in May, and it was jarring to see it like on paper, we knew that it was coming. And we have been in Colorado, and like leaders across the country have been thinking about ways to expand access to abortion care. So what the decision did was attack the right to privacy, gave the decision to make abortion legal back to the states. So it's now, we have a patchwork of states across the country where abortion is either legal or not legal. We have judges blocking bans, unblocking them. It's just chaos and confusion out there. Adrienne, what would you add about the decision specifically?
Perfect. I think there's a couple of things. We at Planned Parenthood have done a lot of community conversations, particularly with Hispanic and Latinx communities in Colorado, in New Mexico, and in Las Vegas, Nevada. And over again, even in highly populated or not very populated rural areas, we know that our communities can hold Catholicism, can hold a sense of family, can hold a sense of decision-making within the community, while also holding the fact that people need to be able to plan for their own futures, and that the government should not be involved in those very, very critical decisions. It is offensive to me when I hear concern that Latinx and Hispanic communities are somehow going to be taking away rights to abortion care because of a religious reason. Now, I know, and my own dad, we disagree on this. I have family members who would never ever believe in abortion care. But again, they're not set out to take that right away from people who have to make tough decisions. And so unfortunately, I think we do lay under a bias that we somehow are not smart enough to be Catholics and to also understand that people should have every opportunity for health care. Thank you.
Can you expand upon what we've seen since this decision has been made? Because I know it's about so much more than,
you bet. So just very quickly, according to census, and just, I want you to feel the colors on this map. There's more of us down south in the Southwest, and you can see the population map there and the ways in which there's the gradation. And then if I look, then let me see if I can do this. There we go. So as Christina said, there are abortion bans or bans in these states. Look who's making decisions for us. And in those states who have come out to restrict or all out ban abortion care. I'm gonna give you one more map and we'll talk about this. Those blue squares are where there's ongoing litigation or fights in the court system where judges are going to be making decisions. So black dots are where elected officials and politicians at the state level have banned abortion care. Blue dots are where mostly grassroots folks are coming together to sue their governments to then put a halt on abortion care bans. And what I want you to know is in Texas, we have people traveling from across that gigantic, very populated state coming into New Mexico and Colorado, where we do have abortion care that is accessible, to Christina's point, because reproductive justice organizations, BIPOC, Black, Indigenous, Latinx, people of color have been organizing for generations to make sure that we have the right to abortion care. And when we see people traveling from Texas, the level of poverty, of shame, of terror, the fear that they're going to be arrested when they get back home is devastating. As you said, Christina, we knew it was coming. I could never have prepared for the gut-wrenching stories that we're hearing in our health centers right now. And the vast majority of our abortion care patients, they're already parents. They've got the kiddos in the car. They want to finish high school. They want to finish college. They want to get economic liberty, as we all do. And access to this care is critical.
Would we say that this feels like a racial issue as well?
It is absolutely a racialized issue. The law, and as you said, when you read the writing, the actual Supreme Court ruling and these laws that are being passed at the state level, they stink of slavery. They stink of the Fugitive Slave Act. They want to come into Colorado to get back their slaves, to get back the workers, to force people to have pregnancies, to force women to have larger families.
Impoverished.
And to be impoverished for a whole nother generation. So yes, it's impacting us the most. It's impacting in my health centers. We're staffed with biracial, Spanish-speaking, bicultural providers. It's very heavy. And I know we're gonna get to hope, Annie. I promise we're gonna get there.
I'm about to go there. We're about to bring us back.
I can feel it. I can feel that we're gonna get there. But I want you to know that because we are so impacted, we are the solution.
Yes.
We are the solution, and it's not gonna happen without us.
Yes. And I think it's important. I think it's important to feel the weight and the plight of this. I think it's okay for us to sit in
Well
this
said.
heavy weighted room because this is a heavy situation. You know, I would hate. I remember where I was when I heard, and I live in California, which let me not assume elections are coming up, you guys. Let's vote. We'd love to assume that it's a liberal state. I come from a liberal family. And even then I realized myself, I have some biases. And I remember I was driving to a conference and I got there and I just started sobbing in front of everyone. And I was like, okay, yes, let's feel the weight of this. Let's let the tears fall. Let's wipe them up, and now let's clean up this shit. What are some calls to action that we can make, and maybe some hope for all of us and for the beautiful babies that are coming after us?
Yeah.
Well, beautiful baby coming after us. Go ahead.
Yes. So I am pregnant, so I feel like I'm doing this work for my beautiful baby.
We're all blessed right now.
Congratulations.
So awesome. In the presence of mine. Yes, but I'll just I want to just tout on RJ organizations for a little bit. Like you said, Adrian, we have been doing this work for so long, and we have been talking to our communities and figuring out where those pain points are whenever folks are trying to access reproductive health care, abortion, contraception, all of it. And in Colorado, we have made some really great strides. Like I said, we knew the Supreme Court what they were going to do, so we worked with our partners to pass the Reproductive Health Equity Act. Making sure that abortion was legal in our state. We had no restrictions on abortion here in Colorado, but we had no protections either. So we wanted to just make sure we solidified that before the decision came down. Before that, we worked to pass the reproductive health care program at our state legislature, which provides a year of contraception for those who are on Medicaid, regardless of documentation status.
That is incredible.
It is
clap, clap, clap.
huge.
Regardless
Yeah.
of documentation.
Right.
Having access to birth control, it's amazing.
Everything, yeah. For families, sometimes families is for everything for them. So that went into effect this past July, and we've been working with community partners to get the word out, get folks enrolled in that program. And we have a game plan. Like the folks who are on the ground in those states that you saw on the map, they have game plans too. They know what's best for their communities, and they need to be centered and lifted up whenever we're talking about solutions for that. So I think my call to action that I would just highlight for y'all is to look for those organizations in your states and your areas. See what they're doing, see what their plan is, and see how you can help them and fight alongside of them in our communities.
Every state has an action that will be done legislatively. It looks very different in Mississippi than it does in California, but there is movement, and we have big wins that we can look to in places like Kansas, where reproductive justice organizations got people out to vote regardless of their political affiliation, what generation they belong to, their race or ethnicity. We know that the vast majority of Americans want people to have access to health care, and that includes abortion care. So you're absolutely right. Working with partners on the ground is critical. Also, in those Planned Parenthoods that are seeing these patients, our patients need a lot more support, a lot more. So, our staff are like calling Lubbock, Texas to ask them, where can this patient get transportation or child care or whatever it may be? And in this country, and particularly in the Southwest, we demonstrate what we care about by how we spend our money. Where our money goes, that's what demonstrates what we care about. We can't rely on taxes or the government to help take care of our neighbors and ourselves. It's absolutely about giving. So I just urge you, if you are able in whatever way, I know you're giving right now, and thank you. And I'd ask you to join me to increase the amounts of funds that are just going by way of donations, because these folks, our patients, our staff, our supporters, and our partners are exhausted. And I mean, if you think you're exhausted, drive in your car for 400 miles with 2 kids in the back for abortion care. That's a long drive. And so just know that it really makes a big difference when that family arrives at our health center and we can say, we got your gas money covered. We got you covered. We got your health care covered. Would you like some birth control on the way home? And they always ask for Burger King. All those kids from Texas. They flippin' love Burger King. I'm like, yes, they can have Burger King. You got it. You got it.
Get that Whopper on your way home.
Get that Whopper. I love it. I love it. Yeah, if we are about what we say we're about, power, culture, truth, let's give back to our communities. This is what is important. This is why we're here having these conversations. So remember, go to your local organizations, get more informed, have these conversations with your more conservative family members. Create an open space there. It's okay if it gets uncomfortable, if it gets heated. It's okay. It's for the betterment of change. I have them all the time with my grandma and my tias and my dad and my mom. This is what we need to do. Get out there and vote.
Yes.
And like Crystal Echohawk said yesterday, what empowers one of us frees and empowers all of us. So let's do the work, you guys. We can do it. It can be fun too, right? This was fun. Thank you so much.
Thank you.
Thank you so much.